This video is meant for people who are newly diagnosed with cancer, and this particular video is specifically for those patients who are newly diagnosed with colon cancer. I'm Dr. Vinay Samuel Gaikwad. I'm Director of Surgical Oncology at CK Birla Hospital in Gurgaon. So many times we are faced with situations in which we don't know exactly what to do, and one situation is when we are freshly detected with a cancer, which is a very dreaded disease. So there's not much information to help guide us when we're faced with this panicky situation and we're just detected with this diagnosis called colon cancer. Usually we're diagnosed with this cancer after a colonoscopy, which is usually either preceding, after symptoms such as altered bowel habits or loss of weight or blood in a stool. And sometimes it can also be because of routine screening. Whichever way it is, if a colonoscopy is done and you're detected with a diagnosis of cancer, which is established based on a biopsy report, the first thing to do is to try not to panic. It's very difficult to remain calm under such situations. We never dreamed that this disease could possibly affect us, but this disease can happen to anybody, literally. So once the biopsy confirms that it's a cancer, it's better not to be in denial, and it's better to accept the fact that yes, this is a cancer, and let's do our best to get it treated and cured whenever possible. So one of the things we do initially when you consult an oncologist or a colorectal surgeon or a GI oncosurgeon, they will ask for a few blood tests, including a routine blood report and a CEA, which is a tumor marker or carcinoembryonic antigen, and also an imaging, either a CT scan of the abdomen and chest or a PET scan, which is a specific scan for cancer. So once we confirm that the disease is localized to the colon and not spread to other parts of the body, such as the liver or lung, then the intent or the goal of treatment will be curative, or we will be more hopeful for a cure. If unfortunately the disease has spread to other parts of the body, like the liver, let's say, then there's still a chance of cure if we can contain the disease completely. The only problem is if there are too many metastases or spread of disease to multiple organs, then the chances of cure go down. So let's say the disease is localized to the colon, and maybe the lymph node glands surrounding the lesion, then the first treatment option would be surgery to remove the disease completely. The surgery is the most important part of your treatment. The operation is what is going to be done to remove the tumor completely, as well as remove the surrounding lymph nodes which might be harboring the disease or the cancer. By doing this, we will be more certain that we can completely eliminate this disease. Although there cannot be any guarantees, but yes, this is the best chance that one has. This surgery is done either through minimally invasive techniques such as laparoscopy or robotic surgery, and sometimes might even be have to be done in the conventional open technique. But nowadays most surgeons will offer minimally invasive techniques to remove the surgery, which has been shown to be equally good or perhaps better than the conventional surgery. So once the tumor has been removed, there's nothing to be afraid of. This surgery is very safe. It can be done, it takes a couple of hours to do the surgery, and you stay in the hospital for maybe 4 days or 5 days at most, and you'll be discharged fully on a diet and fully self-sufficient. After this surgery is done and you've been discharged, the biopsy report or the histopathology report comes in, and based on the analysis of that report, further treatment will be decided, such as whether you need chemotherapy or not. Not all patients with colon cancer require chemotherapy, but if the lymph nodes are involved or any other high risk factors are present, then yes, chemotherapy will be suggested, and the chemotherapy protocol is usually a six-month protocol involving 12 cycles, 2 weekly. So that's something you can keep in mind roughly. Yes, it's true that all patients may not require it, but it is something that has to be kept in mind even before the surgery is done. So after this is done, the follow-up happens at a timely interval, so that we make sure that there is no chance or hint of the cancer coming back, so that it can be tackled appropriately at the right time. So that's just in a gist of how to deal with a freshly diagnosed situation of colon cancer. I hope this video has been helpful, and I will try to make more videos on gastrointestinal cancers, which is my area of expertise. Thank you for your attention.